I'm one of the consultants here at UCLH. One of the really important things about our unit is it's there specifically for the age group of teenagers and young adults and delivering excellent care, but also giving appropriate support as people are going through that care. One of the ethoses of our unit is that we put you at the centre, so you understanding what's going to happen, why that's going to happen, and what the different stages of the treatment is really very, very important to us. And to that end, we've assembled a team of experts to support you throughout the whole journey.
Coming into hospital can be really stressful for yourself and for your family. So you can have a family member, a friend, a carer stay with you at all times to support you through that process. I work closely with the nursing teams, the clinical nurse specialists and our ward sisters in making sure that your experience here at UCLH is as positive as possible.
I feel passionately about teenage cancer care. We know that you're facing enough challenges and a day-to-day life anyway without the diagnosis thrown in. So we're there to encourage you to go through as normal things as we can whilst undergoing the treatment that you're having in hospital. You know, for some people, home is really, really far away, so we want it to feel like a home-from-home environment.
I'm an occupational therapist. I have a lovely group of physiotherapy colleagues that work alongside me. Physios focus on mobility and your exercise tolerance and overall activity levels. Occupational therapists, we focus more on functional things, your ability to do tasks that you want to be able to do and need to be able to do. We hope to get you as independent as possible throughout your treatment and beyond.
Here at UCLH, we offer specialist treatment that are not available elsewhere in the country. And some of our patients have not even been to London before. So our role is to liaise with the family and the patient to make sure that you come to the first appointment feeling confident, feeling expected, feeling happy, and feeling safe within the team.
Our main goal is to be there for the patient at all times, before, during and after diagnosis as well. And we advocate for you. You may have questions around your treatment, questions around what to do with work, how to tell your friends or how to tell your family. And we will be there to support you with that as well.
I'm one of the haematology team leaders. There's a wider team behind the scenes that's always supporting the clinical team in all aspects. And we're always there to support you with any appointments, any scans, and just making sure that that pathway runs smoothly.
As a key facilitator at radiotherapy and proton beam therapy, my role is to make sure that everyone that you meet along the pathway is understanding of your treatment, but that you have a full understanding of your treatment. So we can sit down, go through your treatment plans, reduce any anxieties or worries that you might have about having your treatment, and also reassure those around you, whether that be your family or your friends.
My role is to be your key worker throughout your radiotherapy treatment, so your first point of contact if you've got any issues. Our treatment radiographers are very good at being able to answer a lot of your questions, but for the more problematic or technical things that they may not be able to answer, that would be where I would come in. A lot of patients find that it's quite nice to have somebody just to vent to, and I can be that person for you as well.
So as a pharmacist, my role is to perform safety checks on the chemotherapy. So it's checking that the treatment that's prescribed for you is the right treatment for the condition that you're being treated for, that it's appropriate for your weight, and any side effects or toxicities you might have had with previous treatment, that we're taking those into account. So it's really important that patients understand their medications, know what they're doing with them, and are able to ask, any questions.
I'm the clinical lead for the psych-oncology team. So going through cancer treatment is an enormous thing. It's really tough in different ways for different people. And we're pleased to be able to offer psychological support to you and to the people around you.
I'm a clinical psychologist and I work with psychotherapists and psychiatrists. We're there to walk alongside these young people and offer some support in them difficult moments. And it may be that you need none, but we're here if you do.
I believe great patient care can be achieved by looking at the UCLH values. Obviously safety, patient safety is paramount. Then looking at kindness to your team members and kindness to the patients. Teamwork, everybody working together as one team with the patient central, all striving for the same thing, which is excellent patient care. And then always striving to improve using evidence-based medicine and always trying to do better.
As an AMP, we are senior nurses. We're going to look after you physically when you're here. So we'll look after your side effects, make sure you are fit for treatment, look after symptom management. So when you come to the service, you're going to encounter a lot of different professionals. And you need to remember that at any stage you need someone to talk. We are always going to be there for you.